is about making the Trust Special Administrator who tried to close Lewisham and was stopped by the law because it was illegal, unlawful. It's about giving him those rights, giving Special Administrator rights to close any hospital they want in the country on very sweeping powers. I mean, they don't have to consult with local people, they don't have to pay attention to what local GPs think or to what the local council thinks. So it's the beginning of a whole attack on our NHS hospitals. A third of NHS hospital trusts are in financial deficit, a quarter of foundation trusts are in financial deficit. Not because there's anything wrong with those hospitals, but because of the way that the government is funding those hospitals. But they're going to use those deficits as an excuse to close other hospitals in the vicinity. And we could see up to a third of hospitals being closed. We must fight that.
We've been campaigning around 4 hospitals, Ealing, Charing Cross, Hammersmith and Central Middlesex. The hospital in our borough is Ealing. We've been fighting what feels like forever. There's Eric, Pam and other people here from our campaign. We've kept going, it's been difficult. We've gone through a so-called consultation process, which was a complete and utter waste of time. The people of Ealing said, leave our hospital alone, and of course the decision that was made by NHS North West London was, I think we'll just ignore all that and go ahead and shut the A&E, the maternity and the children's services.
But it's fantastic when clinicians can stand up against this. But I want to make everybody aware of a clinician who was also a union member, Charlotte Monroe in Whips Cross, who has paid a massively high price for speaking out. She spoke out at her local scrutiny committee. If you don't think that's democratic, that a voted representative can speak out at a council that is also supposed to be democratic, and she gets sacked for that, what they are trying to do is make a very clear warning and use Charlotte as an example. And I think it's incredibly important that we all support that Whips Cross case, because that's critical for the future of the NHS. Absolutely.
Hard as it is for me as an individual to go through what I'm going through, I think the important issues are the principles at stake. The principles that staff and unions have a right to an independent voice. Unions have a right to organise their members and their staff in order to take a stand for and actually impact on their pay, conditions, rights and jobs. And also that there has to be a culture within the NHS, which is a caring service, a culture in which people are confident to speak out. Whether it be within a small meeting within their team, whether it be within a meeting within their directorate, whether it be in a public debate. We have to be able to have a discussion that's grounded on the reality that the staff experience day to day, the patients experience day to day, and without fear.
We've been out on the streets, we've been demonstrating, we've had 2 demos, we're still going. It gives us great heart that there are others campaigning as well. It's important for us today to come here, to all be together. We need to do more things across London, because as everybody knows, it's not just an attack on Ealing or Charing Cross or Hammersmith or Lewisham. It's a fundamental attack on our health service. They want to privatise it, hand it over to all their mates, as the government wants to hand it over to all their private sector mates to make huge loads of profits. We've got people being sacked for standing up, for speaking out and for daring to say, hey, there's cuts going on in my hospital. We all need to stand together, campaigners, GPs, consultants, people in the community and workers in the hospital, and we really do need to do more things across London. We've done some things. There's going to be a motion going to have a demonstration later in the summer. Obviously in the meantime we need to keep on. Yeah. And Louise and other people in Lewisham, you're an inspiration to us all.
It's fantastic that Ealing and the GMB and Lewisham and all the other campaigns around the country are coming together about this clause. It's really, really serious, and I completely agree. It's one of the most democratic issues of the moment, to preserve our rights to healthcare for those that have nothing, and to do that now is a fantastic achievement. And thank you to 38 Degrees and everybody. It's also the song from the NHS choir if you're interested, but don't forget to download it.
Clause 118 is something that I think we can defeat. That we can defeat it because we can put huge pressure on those MPs who are in constituencies where their local hospital may be closed, and that means we can even put pressure on Lib Dems and even some Tories to vote against this. We've already got 144 signatures. We're going to hand this in, but this is not 144,000 signatures. I just think in terms of thousands now, you see. That's the problem. And but we're going to keep on collecting these signatures. We're hoping to get 200,000 because this bill, although there's going to be a debate in Parliament today and a vote, is not the end of the road. This clause 118 will come back, and there will be a crucial crunch vote in Parliament, maybe in February, and we are going to keep on mobilising, and on that day we're going to have an even bigger turnout than we have today. We're probably going to go down there and there'll be lobbying down there, so we'll have 200,000 signatures at least. But this is our beginning of our campaign against clause 118, not the end of the campaign. So it's fantastic to see so many people here. I think we'll do some chanting about clause 118, and then in a minute or two I'll go and hand it in to people.
We must lobby our end. Yeah, it's really great to see so many people here. It's really heartening that everyone still cares about the NHS, and even as a government keeps trying to do stuff like clause 118, that we're ready to fight them, and it's just really brilliant. So keep reading your emails. We'll keep going with this, and it'll be really great. The more of us that can help fight this, the more chance we have of winning. So thank you all for coming. It's been really great. The Department of Health have not sent someone down. It doesn't look like they're going to, which, you know, you can read into that what you will. Yeah, thank you so much.